Welcome in. Welcome to the National African American Child and Family Research Center's Research Capacity Building webinar. I am Latrice Rollins. I'm honored to serve as the director of the center, as well as the principal investigator. We love to have these sessions for everyone to learn more about research, particularly from a community engaged research space. And we are especially honored today to be talking about how to take our research into the policy realm. So, I'm going to give our disclaimer, long disclaimer, that anything that is said or shared here are definitely the opinions of those who are speaking them. They are not the opinions of the Health and Human Services Department, nor the Office of Planning, Research, and Evaluation, or the Administration for Children and Families. All right. So we are going to jump right into bridging research to policy. I'm going to introduce our speakers, our first set of speakers. So Miranda Lynch-Smith is the Chief Strategy Officer at Chapin Hall. In this position, she focuses on developing actionable policy solutions, building strategic partnerships, advancing interdisciplinary research, and driving cross-sector collaborations. She plays a key role in shaping Chapin Hall's policy agenda by translating research into impact, as well as identifying new opportunities to address pressing challenges impacting children and families. Prior to joining Chapin Hall, Miranda was serving in multiple senior leadership roles in the Department of Health and Human Services and also as a senior advisor to the White House Domestic Policy Council. She has more than 25 years of experience working in the federal government, where she shaped and evaluated federal and state legislation, regulations, and policies related to child welfare and broader human services programs. Prisca Tuyishime is a policy analyst at Chapin Hall. Her work centers on making research practical and usable, whether she is developing continuous quality improvement frameworks, managing evaluations of prevention and kinship care programs, or translating complex mixed methods data into actionable and accessible insights for policymakers and practitioners. She has extensive experience supporting jurisdictions such as Maryland, Michigan, New York, Nebraska, and Florida to align their research evidence with real-world decision-making. Grounded in both policy analysis and community engagement, she focuses on building bridges between researchers, policy officials, and community partnerships so that evidence not only informs policy, but also strengthens relationships and drives meaningful change for families. She is also a clinical social worker. And so that experience helps to keep her closely connected to the realities that families face and deepens her commitment to making research meaningful in practice. So I'll now give the floor to our Chapin Hall team.
Thank you so much, Dr. Rollins. Just confirming that you can indeed see my screen.
Yes.
Wonderful. Thank you so much for the invitation from you and the center to present today. So just a little bit about Chapin Hall. Chapin Hall is an independent policy research center that provides decision makers with rigorous research and achievable solutions to support them in improving the lives of children, families, and communities. We work across several impact areas, including community capacity, which involves work from early childhood to juvenile justice and community violence, youth homelessness, and child welfare, including economic and concrete supports and other upstream prevention approaches, all the way through permanency. We're celebrating our 40th year as an organization, including our legacy of rigorous study and our future in applying that knowledge in real world context for positive change for families. And we are truly committed to shaping a society that helps all families succeed, particularly those who are impacted by hardship and inequality. So, as Dr. Rollins said, I personally have been involved in policymaking roles at the federal government level for some time, and I like to help people think about what it means to use evidence to influence policy using that lens, from the policymaker lens. So I want to touch on this before we get into more of the detail about Chapin Hall's approach and turning it over to my colleague, Prisca. So the first pointer is really about thinking about who and what you are influencing for what kind of policy change. Knowing the outcomes you want to seek to change and thinking through who is responsible for that particular area and pulling that particular policy lever to accomplish and scale change is really key to getting started in thinking about how to use evidence for a policy change. For example, the government takes on many different roles, wears many different hats, whether you're talking about the federal level or state or local. Some are big P policy roles, like designing the policy or the system through legislation or enforcing a law through regulation. And typically, when you're informing that kind of policy, you require really solid information on population level outcomes and program effectiveness. But some of the roles that a policymaker takes on is more in the space of little p or implementation roles. For example, you might have evidence that indicates that there are gaps in who's receiving services or what our data collections are telling us and don't tell us about who is being served, the quality and the outcomes of those circumstances. So you may need to approach government staff and the policymakers that are in those roles about what data they are collecting, what indicators they're using, what evaluations and kinds of continuous quality improvement they're sponsoring on an ongoing basis. Or perhaps you have knowledge and evidence that the most effective programs are not getting the uptake that is needed. And you have information about that organizations don't actually know about the most effective programs or have the right set of capabilities to take on those programs. So you may need to seek out policymakers or staff who are responsible for convening functions, for dissemination functions, or technical assistance. The point is just to be considerate of all the possible policy design and implementation opportunities in making a connection between the evidence that you have and that is helpful to spur insights and potential changes. The second high-level takeaway for you is about framing your evidence so that it is most likely to be heard, to be felt by the policymaker, and because of that, acted on. So here are a few ways to think about effective frameworks. One is to talk about the return on investment. Policymakers are always concerned about if they're able to invest their next dollar, where should it go? And what can they expect for that investment of that $1 in something versus something else? So it's really powerful, particularly when you're talking to legislators. They're always worried about costs and how much of a budget they have. It's powerful to talk about the return on investment. In terms of your framing of your evidence, talking about the hope and the opportunity to improve lives is a much more engaging way to invite action versus the avoidance of problems. So think about if you can reorient your evidence to talk about how you can provide hope and opportunity by acting on it. Policymakers find local and personal comparisons really helpful. This is ways in which you can indicate that you have evidence that an intervention is working or effective in diverse locations, particularly if there's political diversity or geographic and population diversity. So can you explain that your evidence is effective in Texas versus California, in Albuquerque versus New York, for one population versus another? Being able to tell that story and make it real for a policymaker is helpful. It's also just really important to understand the context and the constraints that a policymaker may be operating within. They have priorities, and to the extent that you can frame the evidence that you have in alignment with their priorities, it's going to get heard more readily. Also, lining up your champions that have similar information about evidence is helpful. Repetition over and over again, hearing the same kind of information about impact or effectiveness from different perspectives, from different researchers is helpful to prove the point that the evidence is worth listening to. And I talked about this big P, little p concept in the last slide, so I won't go into detail again about that. But again, just to be thoughtful about the different ways that you can influence policy. So I'm going to switch a little bit and move on to how we at Chapin Hall think about operationalizing evidence to action in broad strokes. We as an organization walk shoulder to shoulder with our partners in the full life cycle of gaining knowledge to applying it. Because our experience as policymakers and system administrators and practitioners ourselves is that it's really needed, that they often don't have time and capacity to fulfill all those roles. So it is helpful to really bring that research to life and help them to apply it soup to nuts. So we always start with a full understanding of what the evidence is, what we know. We often use mixed method approaches. So we conduct systematic reviews to appreciate what the literature says. We learn from those who are most impacted. We also learn from those who have lived expertise in other ways, people who may be policymakers, practitioners, and administrators that can speak to the challenges of a particular policy or approach and its effectiveness. And it's really important for us to synthesize that information in a way that clearly extracts the learnings, translates it, and make meaning of the findings so it can be most useful. We then pair these findings with policy opportunities to give it an anchoring in the possible change that can yield better outcomes, meaning should there be a system or practice shift in relation to the evidence. Then we like to get granular, providing more nuanced and actionable insights that make clear the multiple choice points for jurisdictions or for partners. We know that just because evidence shows that something is effective, it doesn't mean that it's the only option out there. So we like to provide information about what the range of choice points are. Again, it goes kind of back to that return on investment. Finally, we support our partners through implementation so that they are applying that evidence throughout their policy ecosystem, throughout their implementation, and continuing to assess its impact and the opportunity to improve and get even more information evidence about your results and the ways that you might need to adjust. So we wanted to talk about a concrete example of where we have done this in the space of economic and concrete supports. Chapin Hall conducted a synthesis of the research about the ways in which things like cash transfers, meeting the material needs of families in various forms, reduces child welfare exposure, reduces child maltreatment, and child welfare involvement. So we looked across a variety of studies and we extracted and translated the bottom lines out of that synthesis. We summarized it in many briefs and forums. We had convenings. We wanted to get the news out in as many ways as possible about what we were finding of the effectiveness of economic and concrete supports to be a positive force of resilience for families. We then identified those policy opportunities about how they could be a valuable tool and prevent child welfare involvement. We came up with a lovely roadmap that provided the visual, provided the hope and the opportunity for redesigning child welfare system responses and other system responses to use this evidence and provide more family supports. And we talked about the implications for things like strengthening cross-sector collaboration across child welfare and human service programs, and coming into alignment about the opportunities to improve family stability and well-being. We talked about the implications for increasing access to economic assistance programs with a focus on reducing family barriers. And we also talked about the implications for revising definitions and approaches to neglect so that they distinguish poverty-related needs from child maltreatment. Then we kind of moved into this idea of how can we make it really concrete and tangible for jurisdictions about how they can act on this information. So we developed a tool like the one you see on the top right of the screen. You probably can't see all the detail, but what we laid out was kind of point by evidence point. What did the evidence say about things like earned income tax credits and child care subsidies? What were the particular evidence points about how those acted to reduce child welfare involvement? And then we laid out what were the specific opportunities for states and jurisdictions to make changes to their childcare policies, their tax policies, their access points, et cetera, so that they could use this evidence and have more impact on positive impact on child and family lives. Finally, this bottom right portion of the screen just laid out what we were doing within the context of a particular state, which is to be, again, at their shoulder, side by side, looking at their specific policies, their specific implementation barriers, and mapping out, based on the evidence, what specific things they could change that we could see could have a pretty reliable impact on short and long-term outcomes for children and families in terms of their reduced child welfare involvement. So I will hand it over to Prisca now to continue the conversation about New York.
Thank you. So to begin, what my task will be is to essentially show you all how these steps took shape inside New York City's child welfare policy and where evidence is being actively translated into child welfare strategies. So this work really began with New York City Administration for Children's Services asking a hard but necessary question. If poverty is a predictor of involvement in the system, how can child welfare directly be structured to address it? And so ultimately, the decision point for the New York City Administration for Children's Services was recognizing how poverty as a root driver of child welfare is a root driver of child welfare involvement, essentially. And so from what Miranda kind of brushed on, and a lot of the literature that Chape and Ho, our colleagues, have made are public on our site, is essentially decades of research already showing that material hardship increases the risk of neglect, and then lack of access to these concrete supports also perpetuates cycles of involvement. Meanwhile, evidence also shows that cash, housing, food, and other tax credits will reduce child welfare contact. So when we started this work, basically talking about why we started, we grounded ourselves in what the evidence already showed. And so, oh, sorry. The next slide. Thank you. And so, as you can see, nationally, over 85% of families investigated by child welfare, child protective services live below 200% of the federal poverty level. And then, as you can see, more than 60% of substantiated cases are neglect only and often not tied to maltreatment, but to unmet material hardship. And so research also makes it clear that with economic shocks, such as losing a job or facing a sudden expense, sharply increases the risk of CPS involvement. And so that recognition became New York City ACS's decision point in naming poverty as a systemic driver of involvement. This choice laid essentially the foundation of the poverty alleviation strategy, which has since evolved to economic and concrete resources and supports, integration initiatives, or as we call it, ECRS. In this case, going back to the slide that that Miranda kind of brushed on the 4 phases, extracting and translating research meant moving from raw statistics to a clear narrative about what drives child welfare involvement. And the gap was clear in this case that families were already facing poverty, housing instability, and economic shocks. Next slide. So because evidence alone doesn't move systems, it has to be connected to policy levers and agency infrastructure, which is where Chapin Hall co-facilitated cross-agency alignment with the New York City ACS. So in this case, instead of siloed services, the findings were paired. We pair these findings with policy and practice opportunities. So essentially, what are economic and concrete resources and supports, or in this case, ECRS? These are tangible supports, as displayed out here are some examples. They're tangible supports that can make the difference between instability and stability for families. These are housing subsidies. These are public benefits like SNAP and cash assistance, such as tax credit, earned income tax credit, and the child tax credit, including child care vouchers, employment, training referrals, financial coaching, and then the list goes on. These are what, as a group, when we co-facilitated conversations within work group, these are the ones that throughout within ACS were identified and determined as the economic concrete resources and support drivers. So essentially, what matters here is not just the list, but the fact that these supports, when coordinated and accessible, can prevent child welfare involvement by stabilizing families before crisis escalates. Next slide. So if we look back around providing actionable insights, so to ground us, this theory of change essentially outlines the initiative's core commitment, which is that systematically identifying economic needs and connecting families to tangible supports can reduce child welfare and juvenile justice involvement. Essentially, the intention is not only crisis response, but upstream prevention, stabilizing financial circumstances now while supporting long-term economic mobility. So this framing hopefully helps position ECRS as both a safety net and a launch pad for family well-being. Essentially, the goal is clear in this effort or endeavor, which is to improve family and child well-being, prevent initial CPS involvement, reduce re-involvement for families already in the system, and ultimately build pathways for long-term financial stability and economic mobility. So as you can see here is the city's commitment around assessing family economic needs systematically, connecting families and youth to concrete resources that were listed in the previous slides during involvement and after. So not just saying pass the baton and you go figure it out. It's more in the sense, pass the baton and how can we make it sustainable to make sure these families have continuous access to the resources and benefits that were listed in the prior slide. And then essentially stabilizing. So in here, the expected outcome is stabilized crisis, reduce CPS involvement, improve well-being, and support mobility. Next slide. So now we're talking about facilitating implementation. And here, I just kind of wanted to do a high-level overview because there's a lot more involved in here. But for the case of today's presentation, I wanted to do a high-level overview of where we started and then where we're at and where we hope to go. So this slide, we move from strategy to integration to implementation. So in 2023, we began with the poverty alleviation strategy, which I highlighted in the slides earlier, which framed poverty as a driver of ACS involvement. And then Chapin Hall worked alongside New York City ACS through these working groups between 2022 and 2023 to build the theory of change, draft logic model, and then start exploring funding strategies, either within or philanthropic opportunities externally. And then by 2022, the work matured into what we call now economic and concrete resources and supports, ECRS. Essentially here, it's building ACS's recognition of poverty as a core driver of child welfare involvement, and then Chapin supporting the process that incorporated family and provider perspectives, essentially because they were core in deciding which were the indicators and identifiers to shape how that decision point translated into strategy. So our role was to co-facilitate and guide this translation while co-leading a cross-agency alignment around a shaped framework clarifying how ECS opportunities could be integrated into practice. And then now, and then what we hope beyond, efforts to co-develop ECS program models are underway. And then Chapin Hall's role shifted from being the researcher in co-design to the what in ACS co-collaborative quality improvement infrastructure to essentially make that process more sustainable, and also incorporate ECRS evaluation loops as well. So in this case, ensuring CQI dashboards, standardized tools, and outcome measures are in place to track both short and long-term mobility. So across these phases, you can see the 3-line. Evidence was extracted and translated into clear understanding of poverty. Those findings were paired with policy opportunities, aligning agencies and identifying ECRS categories. Actionable insights were developed through theory of change and CQI frameworks, but in the case of New York City ACS, collaborative quality improvement, I'm so sorry. And then finally, what I just laid out for you all is implementation being underway with community partners, and supported by continuous evaluation and learning. So this is very iterative. We're all learning as the process goes, but central to this is the families and providers that we keep getting feedback and referring back to with anything that's being developed. So essentially where we're going, just wanted to show some short, medium, and long term. So as you see, research, policy, and practice must continue moving together. So in here, our short term is immediate system alignment and infrastructure, which is the work that's underway. And then our medium term is essentially scaling across New York City ACS providers. And then our long term, our hope is to position New York City as a national model for embedding anti-poverty strategies directly in their child welfare. Essentially, we in this call, as we close, I want to bring us back to the bigger picture. So the cycle that's seen here is one approach to continuous quality improvement. It shows a way that evidence can become action through testing, learning, and refining until changes take hold. So in the spirit of what we're applying to this poverty alleviation strategy is not to treat it as a one-time initiative, but finding ways to weave it into everyday policy decisions and frontline practices. I think that is all we have, and I want to leave time for questions towards the end, as Latrice had mentioned.
Awesome. Thank you so much, Miranda and Prisca, for that excellent foundation and for the work that you all are doing. So again, you all, if you have any comments or any additional resources you want to share, please put those in the chat. And if you have any questions for Prisca and Miranda, please put those in the Q&A box. All right, we're going to move now to our next presenter, Dr. Michael Stoll. He is a professor of public policy in the Luskin School of Public Affairs and director of the policy project in the Bunch Center for African American Studies at the University of California, Los Angeles, or UCLA. He serves as a board member for the American Institute for Research, as a fellow at the Institute for Research on Poverty at the University of Wisconsin, among other places. And he also served as a fellow at the Brookings Institution, the American Institute for Research, and National Poverty Center at the University of Michigan, Ann Arbor. He also served as a visiting scholar at the Russell Sage Foundation. Dr. Stoll's published work explores questions of poverty, labor markets, migration, and crime. His past work includes an examination of the labor market difficulties of less skilled workers, in particular the role that racial residential segregation, job location patterns, job skill demands, job competition, and just various factors play a role in limiting employment opportunities. Much of his work has been featured in a variety of media outlets, and he also is regularly advising the Department of Health and Human Services and Labor, as well as state and local governments in various capacities. So we will now have Dr. Stoll.
I wanted to talk a little bit about projects at our Center for what we call the Black Policy Project at UCLA's African American Studies Center, the Bunch Center. And so I come at this work as an academic, and I had an opportunity to do this. It turns out that one of our former students who got a master's in public policy at UCLA started this Black Policy Project at the Bunch Center because he wanted to do the same thing. And it turned out that he did it so successfully that he decided to run for the California Assembly, won a seat, and now is the legislative leader, one of the legislative leaders in the California Senate, Isaac Bryant. When he left the policy project, he asked me to lead it. And I was honored to do so. And I was at that time in the stage of my career where I could pivot to do this kind of work, where I could do what I define as academic research that could be easily digested by policymakers and the community in order to affect change. And what we do at the Black Policy Project is essentially that. And we're doing that work essentially to improve the lives of Black Californians. So I really like Chapin Hall's description of the ways in which you could affect the policymaking process. And so this presentation dovetails nicely with their presentation. And because I wanted to show you two recent projects of many that we've been engaged with that make this case that you could do good research and actually have an impact by influencing the community to have voice, but also to provide evidence and at least policy information for key legislatures. The Black Policy Project, we work with all kinds of stakeholders, but most importantly to our state policymakers, is in addition to local policymakers such as the city and a recent project with the mayor of Los Angeles. But the two projects I wanted to show you were related to the state's efforts to understand and address reparations for African Americans. And the other is our ongoing work with the Legislative Black Caucus, who is the Black Caucus representatives of the California State Legislature. And for that latter project, what I'm going to show you is work that I've done to establish an index that shows the extent to which Black Californians fare to other groups, so that the Black Legislative Caucus could understand where the biggest gaps are with regard to Black outcomes that could be impacted, or that should be and ought to be impacted by legislation. So first, our work with the California Task Force for the Study of Reparations. This was a task force that was established by the governor that included legislators, including members of the Legislative Black Caucus, but also other members at large, such as academics, lawyers, important community members, etc. And what this project was to understand the harms to Black Californians over time and why they may justify calls for reparations. The Black Policy Project was asked to partner in this effort in the following way. The task force wanted to know what was the community's voice with regard to support for reparations and their understanding of the areas of harm that Black Californians may have experienced. We partnered with them because we were able to demonstrate that we could provide academic research to help them answer these questions. And what were the ways that we could do this? And this slide just gives you more background on this task force. I won't go into the details. In fact, I think we can make these slides available to people if they want them. I would be more than happy to distribute them to you. So I won't talk about these details. But what I will say, as part of this conversation, is that we were asked to collect data from the community to help the task force understand the level of support for reparations, as well as the harms that uh, Black Californians may have experienced, as well as proposals for reparations that the legislature could consider. And what we did is we designed a research project statewide to understand the levels of support for reparations, as well as to identify the key areas of harm. And how we did this is that we established 17 community listening sessions across the state, led by a professional moderator who had the same script of questioning. Community members at writ large in California, doesn't matter your racial background, everybody was invited to attend. And we conducted these listening sessions over the period of January to August 2022. Now, what we did at these listening sessions that was academic is that we recorded every session. The second thing we also did was to conduct a statewide representative survey of all Californians with an oversample of Black Californians to understand quantitatively the levels of support for reparations overall and for different kinds of reparations. And then we also collected personal testimonies. And then we use methods to study each one of these data sources. For the listening sessions, we recorded them. We used state-of-the-art qualitative methods to understand the major themes that emerge from these 17 listening sessions. And then for the survey results, we used basic quantitative methods to understand the levels of support in percentage terms for reparations generally and different forms of reparations. Right. And so what were the key findings here? It turns out that across any type of racial group, there was broad support for reparations, but that support varied. Like there was, for some, limited support for monetary reparations, but there was broad support for reparations in the form of educational opportunities, for the provision of land that was taken by state in various different means, including eminent domain historically, et cetera, et cetera, et cetera. We also, from mainly Black Californians, understood the major areas that they define as harm because of their race. And those are listed there: the lack of educational opportunities, discriminatory policing, economic disenfranchisement, including from home ownership, as you know, or may not know. California, even though it was a free state, was one of the first to establish racial housing covenants that restricted where Black people could buy homes that was exported to other states, as well as health disparities. And we also tried to understand what kind of reparation measures were most likely to be supported. And as I said, even though there was broad support, there was more limited support for monetary reparations, but there was clearly support for other kinds of what we call monetary reparations, but just not cash. So that was an example of what we did for the state legislature. We submitted our report to the legislature. They considered those research findings as they deliberated research proposals, and that's still ongoing. Unfortunately, for this effort, as you may or may not know, California's economy has been struggling recently, as all are, so there is very few dollars on the table to talk seriously about major reparations proposals. The federal climate around talks about race and racial inequality has changed dramatically, limiting what options may or may not be considered, although there is a significant policy proposal that's coming down currently that is influenced by our research, suggesting that there may be consideration in higher education admissions for people that were formerly enslaved. So we can avoid questions about racial preferences and admission and talk about direct harm from enslavement. The second project that I want to talk to you about is our ongoing work with the Legislative Black Caucus of the California Assembly. This is ongoing work. Part of our existence is to support the Legislative Black Caucus's efforts in policymaking. And then one of the things that the Black Policy Project did is we developed what we call an index of equality, which is to collect data across the state and for every major metropolitan area in the state, for every racial and ethnic group, in order to look at the extent to which racial groups differ in their socioeconomic outcomes. We do that in order to provide a window in where policymaking could have the most impact in improving the lives of Black Californians. And in this index, what we do is we collect about 60 different outcomes across 6 major areas: economics, housing, education, health, criminal justice, and civic participation. And then we collect these for each major racial and ethnic group, and we collected them for 2 points in time. And we made an index of equality, which I won't show you the method by which to do. I have slides at the end of this presentation that discusses more of the method. But what we use this data for is to understand where there are racial gaps in outcomes and where policymaking can have the greatest impact. And I'll talk about some of these results in just a moment. And I'll also talk a little bit about what some of those indicators are. But I wanted to show you the broad results of this index. And again, we're using a lot of data that we collect from various different sources, from federal government sources, state sources, local sources, across those 6 different domains that I just mentioned. And this index is neat because it shows you how far racial groups are from one another in socioeconomic terms. So here we see for the year 2020, the extent to which racial groups differ in their outcome from white Californians. So Asian American Californian outcomes are actually greater than those possessed by whites. But the main bar to look at is the yellow bar for Black Californians. This shows that across all these different outcomes, and given the weights that are put in this index, it shows that Black Californians are about 70% that of white Californians in socioeconomic outcomes. Right? It's interesting because of the 3/5 rule from back in the 1700s and 1800s, talking about the value of Black life relative to white life. It's not that far. That 2/3, 3/5 of a man number. And then we have similar number for Latino and also for Indigenous Native Americans. But what we also did was to show these outcomes for different sectors, right? So here's the inequality index for Black Californians. To the left is the equality index I just showed you, 0.69. And then this shows you the different components that make up the index. So where is the racial difference of Black Californians to white Californians the greatest? Well, it's in economics and education. Right, Black Californians actually outperform whites in civic education, which is consistent with a lot of research. We also do this by each major metropolitan area, so that policymakers could see where in the state are these racial gaps the greatest, and where might resources be targeted by geography in order to lift Black Californian outcomes up. Right? I won't talk about those results too much there. But the neat thing about this index too is that you could show changes over time. And so this shows the change in this index from 2000 to 2020. And it shows that the index only improved by 3 percentage points for Black Californians. That's over a 20-year period. And we could do this index for each state or nationally, et cetera. But the main thing I wanted to show, and what I told the legislature, is that if Black progress in California continued at that pace, it would take 248 years for Black Californians to get parity in socioeconomic outcomes with white Californians. And that's assuming that the pace of change remained the same. And all the evidence suggests now that the pace of change is unlikely to be equal to the pace of change that we've witnessed over the last 20 years for all the reasons that we know about. So the findings is that there's big gaps where we also show where there's been the greatest improvement and where the greatest challenges are. I could leave this slide so you could read these in detail, but I want to also make this point, is that when we disaggregated our index more into these subcomponent parts, what we find is that there was closing of racial gaps in important outcomes in one area in particular, education, that was driven by key policy changes that were made at the state. So over this period, it turns out there was a lot of policy attention towards improving high school graduation rates, as well as to make classes that allow students to meet University of California and Cal State University eligibility, to make those classes more accessible to a wider base of public schools. By doing that, the state disproportionately positively benefited Black California high school outcomes, and that significantly closed racial gaps for Black Californians. Um, and and so we use this data on an ongoing basis to talk to legislatures, to show them where their legislative efforts could have the biggest bang for the buck. And we hope to use Chapin Hall's methods and processes of engaging the policymaking process in order to affect that change to the greatest extent. So let me stop there. Thank you for your time. I'd be happy to make these slides available to you. I have more on the back describing the methods used to build the index of inequality, and I'll stop there.
You can also use the chat to share any comments that you have for our presenters. So to get us started, a lot of times we have students on and those who are just getting into research. What would you advise them if they are, interested in translating, their research to policy, particularly when the majority of our audience is focusing specifically on African American or Black children and families?
Is that an open question to the panel?
It is.
So let me just give a viewpoint from our perspective at the policy project. So that comes from conversations with the community and with stakeholders, especially policymakers. And that's something that's hard to do, but that I find very fruitful for understanding what their needs are, because their needs could be as simple as trying to get some basic statistics about a certain problem that they're studying, to more complicated sets of research around what causes it and what policy proposal is likely to have the biggest ROI or the biggest bang for the buck. So conversations with policymakers matter. There's also a lot of good examples from think tanks, from Chapin Hall, from research institutes, where they try to convert technical papers to more easily digestible policy research papers that intelligent lay people have access to. All of these things make this scary world of research that people think is complicated not so complicated. And so let Chapin Hall give an opportunity to respond to. I could talk about this. I teach a class on methods of policy now, but let me let others speak.
Yeah, I would co-sign on that completely. And I think particularly if you're interested in the research aspect of it, to be it's great to specialize, but I think getting really comfortable with mixed methods in research is important, so that you are always thinking about how to tie any quantitative data with the insights from individuals, communities, because we know that those data collections often cannot possibly include the full stories of communities of color, of Black communities, of any community, really, right? So it is in our interests to be able to combine information sources and tell more of a complete picture. And I think, investigating the variety of methods for both quantitative and qualitative analysis in support of learning how to do that well will serve you.
Can I also add to just this one point that I learned recently, late in my career, is that we used to always have this idea of this neat process of policymaking where policymakers really listen to good evidence. And that's true to some extent. But we also know that the policymaking process is messy, as we're seeing now. It's really messy. So what I learned is that what matters too is to inform the community, because the community ultimately has voice and pressure on their legislatures. And this project with the task force on reparation was really revealing, because you could see community wanting to be involved. We involved them by letting them give their voice, but we also provided them the results of our efforts to show what they contributed to, that gave them more power to be able to talk to the legislatures about what they want. And that matters a lot too. So not only are you speaking to these stakeholders, but you're also including the community, because ultimately they have a serious say in what is able to get done or not.
Awesome. You kind of touched on the other question that's in the chat. They're asking specifically about applying for federal grants, and I don't know if you all have any insight on that, but definitely anything you can share about how to move work forward in this current political climate, whether it is doing research, doing work, how do we move?
I think one thing that I would offer is, although the federal government does have a lot of our collective funding, right? And has a very big platform, they are not the only player in town, right? In terms of grants, in terms of securing resources for good work. So I would suggest being intentional about looking for lots of opportunities, whether that is something that is a local funder, a local philanthropy, state government, other sources to support good work. The federal government isn't the only player in town.
Any other thoughts? Okay, excellent. You all are a quiet group today, just taking it all in. I know that our presenters were excellent, so there's not a whole lot of critique, I guess, from the crowd. So that's a good sign. So we do want to know how this webinar was for you all. So I did put a link to our survey in the chat for you all. So please take our survey so that we can continue to provide resources and topics that are important to you all. So please take that. And if there isn't any other questions, we do, Lisa, we do have our webinars on our website, and you can find the recording and all of those things there. If you want the slides, I believe we can share those with you as well. So just let us know if you need those, but we don't typically post the slides, just the recording. But I believe the presenters would be comfortable with you reaching out and letting us know that you want those slides. Okay. All right. Thank you all so very much, and have a
Thanks
great rest
again.
of your day. Thank you for this time.